Welcome back to the Daily Dope. I'm your friend, your homeboy Brando over here, saying the things that you want to hear because nobody on TV is going to say it. In fact, over on TV, they're still spewing the same fucking reefer madness bullshit that, you find everywhere. You've been finding it for over 80 years. It's just absurd. So we got this situation where Fox and Friends is talking about the opioid crisis. Now, I stumbled upon this article here by Zachary Pleat, researcher at Media Matters, and he wrote this up for us. So Fox and Friends blames Medicaid expansion and legalized marijuana for making the opioid crisis worse. What? Research has shown marijuana has saved lives during this crisis, which began before the Medicaid expansion took effect. In a nutshell. A Fox and Friends segment citing President Donald Trump's State of the Union remarks that his administration will fight the deadly opioid crisis ignored that the president has yet to actually take any action and instead of misleadingly blamed the Affordable Care Act's Medicaid expansion and states' legalization of marijuana for making the opioid crisis worse. Interesting. Trump addressed the opioid crisis that is killing tens of thousands of Americans annually for less than a minute in his January 30th State of the Union address, saying that his administration is committed to fighting the drug epidemic and helping get treatment for those in need. On the February 1st edition of Fox's Fox and Friends over at Fox News, Dr. Kevin Sabet, who worked on drug policy in the Obama White House, gave credit to Trump's Opioid Commission for putting out a very good report and put the onus on Congress to fund its recommendations, saying, quote, "We need funding for it, for the President's Opioid Commission, which was a bipartisan commission. Put out a very good report. Now we need to see Congress and the administration fund those recommendations." Now, I did a report about the recommendations back when that came out, and one of the recommendations was that we implement this sort of rehab type situation where we offer people like drug courts instead of regular courts and stuff. And basically what this is just like taking something that Chris Christie had as a model in his state, New Jersey. And one of the ladies that was on the Opioid Commission is also this corrupt player in the industry that's in the rehab industry. It's an industry, believe it. And so in the rehab industry, they do things like make teenagers that get caught with marijuana swear under oath that they're addicted to marijuana in a statement, and then they send them off to rehab, which is something that their insurance maybe pays, their parents pay for it. That's if they're lucky enough to have some kind of a way to pay for it. Otherwise, they might end up just going to juvie. So anyway, back to the article. Zachary says that the CBS News explained after Trump's address, the administration has not requested the Congress for funds to fight to combat the crisis. My God, I can't talk tonight. So anyway, this is from CBS News. Since October, the White House has dithered on asking Congress for funding to combat the epidemic. In the 97 days since the president declared the crisis a public health emergency, White House Press Secretary Sarah Sanders has been unable to specify how much money the White House would request for funding. She has also not said when they would be submitting a funding request to Congress. After Mr. Trump declared the crisis a public health emergency in October, a declaration that came with a laundry list of action items that have yet to be executed, he has done little to bolster the paltry $57,000 available in Public Health Emergency Fund. That's pretty low. The president declared his third quarter salary of roughly $100,000 to the Department of Health and Human Services to combat the crisis. Oh boy. Well, we almost got $250,000, guys. But that's pocket change compared to the what the Council of Economic Advisors projected The cost of the epidemic in 2015 alone was $504 billion. Oh my God, that's a lot of money. The emergency declaration has accomplished little because there's no funding behind it, Opioid Commission member and former Congressman Patrick Kennedy told CNN last week. Patrick Kennedy, also a former member of SAM, which is Kevin Sabet's anti-marijuana propaganda machine. Quote, "You can't expect to stem the tide of a public health crisis that is claiming over 64,000 lives per year without putting your money where your mouth is." Now, as much as I hate Kevin Sabet and dislike Patrick Kennedy, there's a couple times when I actually agree with them with some of the things that they've said in these statements, and that might be one of them. You can't just be like, oh yeah, everything Trump did was wrong. He set up this commission, which was a horse shit commission to begin with, and he picked all the wrong people to put on it. And then he took the recommendation list and was like, oh yeah, this is what we could do to change things. Yeah, that's nice. And he tossed that to the side and didn't do shit about it. Just like Chris Christie, the leader of the commission, received over 12,000 comments talking about how cannabis helps people in the opioid crisis by either A, allowing them to use cannabis instead of opioids for chronic pain so they never get addicted in the first place, or B, people that are trying to get off of the addiction are able to use cannabis as a crutch to get off and also as a pain reliever to replace the opioids with. So to discount all those comments in itself just proved that they weren't trying to do fucking shit about this opioid crisis. A day after Trump's address, some Democratic senators sent a letter to the Government Accountability Office asking it to investigate Trump's lack of action after he declared a public health emergency over the opioid crisis in October. But in its February 1st segment on the opioid crisis, Fox and Friends didn't focus on Trump administration's failure to take concrete steps to address the issue. Instead, co-host Ainsley Earhart opened the segment by blaming the Affordable Care Act's 2014 Medicaid expansion for making the crisis worse, citing a Republican report that claimed Medicaid and its expansion contributed to prescription pill fraud. Republicans are always claiming that really small, powerless people are committing fraud. Like, what you're saying is that the poorest people in society who had to get a Medicaid expansion so that they could get pills for their fucking pain, they took them pills and sold them? Is that what you're trying to say? That's the pill fraud you're talking about? Just like the people that don't have jobs are, sitting around scamming the system on unemployment, just like the people that are on food stamps are scamming the system and they're driving around on rims and they got like gold chains and stuff, right? Because the food stamps, that's what they're doing. They're doing food stamp fraud. And it's all bullshit. Meanwhile, their buddies, their corrupt friends that they do all their bidding for, they get away with the biggest frauds ever. Like every fucking day you see something new on the news where some big corporation or some other corrupt ass shit that's connected to the government or the big churches or somebody has some kind of a big scandal. And it has a big way of that they're scamming people, like Wells Fargo scamming 2 million of their own customers. But somehow the Republicans always make reports and blame like the smallest and most powerful or powerless people. Like somehow this is your problem. No, it's not your problem. Anyway, I'm done ranting about that. A January 17 Vox article that examined evidence behind the Republican claim that Medicaid expansion made the opioid crisis worse soundly debunked the theory. As Vox senior reporter German Lopez summed it up, this claim runs into a basic problem, the concept of time. Medicaid didn't expand under Obamacare until 2014, well after the overdose deaths started rising in the late 90s. After the Centers for Disease Control and Prevention in 2011 declared the crisis an epidemic. So, this all kind of started, even before Bush took office. So I don't know if you're really just trying to blame somebody or blame somebody's policies. We know exactly what policies led to this because it's all been hashed out over the last 6 months. I did a report about it. It was a corrupt system where the DEA was basically handcuffed from even enforcing things like how much pills get manufactured or how many people get how many scripts or how many doctors write how many scripts. And I could go on, but that's a whole nother clip. So anyway, the crisis became more about illicit opioids such as heroin and fentanyl rather than conventional opioid painkillers. True, but a lot of the times it's because people move up to the harder stuff or they need something stronger. But the fentanyl has caused the problem of people dying from drug interactions on a fucking horrendously out of control scale. So there's a lot of things to look at there. But it has nothing to do with this bullshit that they're talking about here with the fucking prescription fraud committed by low-level Medicaid recipients, man. Get the fuck out of here, all right? You guys are such idiots at Fox and Friends. I don't even... and just step out of your fucking ivory tower for 1 second, man. Additionally, Lopez noted that Medicaid can play a major part in addressing the opioid epidemic by covering addiction treatment, a point the Kaiser Family Foundation has also made. Toward the end of the Fox segment, Dr. Sabet also blamed increasing legalization of marijuana for part of the opioid crisis. Of course. Why wouldn't he? It's fucking Kevin Sabet. They didn't just get him on here so he could talk about, like, how, you know, some hood rats are scamming the fucking system to get opioid pills and sell them because they got Medicaid. He actually gets on here and defends Medicaid and basically kind of shuts her down with that talking point, and I thank him for that. But I guess he just wanted to get some FaceTime on Fox and Friends so he can put this out. So he said, if we continue to do things like legalize marijuana and these other very harmful policies, we're going to make the opioid crisis much worse. This is an addiction crisis. I don't know what other harmful policies he's talking about, but alcohol is already legal. That's not gonna. We're not going the other way on that. So that's the most dangerous drug there even is. Period. Way more dangerous than all the opioids put together, plus all the benzos all the pills put together, all drugs put together. Don't kill as many people as alcohol every year. And then the co-host, of course she has to be like one of those Fox and Friends snide right-wingers who are acting like your fucking parents or something and you're doing something bad or wrong by, you know, wanting marijuana to be something that people ain't going to jail for because you believe in the nanny state and the fucking big government apparatus that arrests people for fucking putting substances in their body that you don't agree with. So she says, really? You hear that, California? And Sabet adds, and many other states. This is an addiction crisis, not just an opioid crisis. No, idiot, it's not an addiction crisis. It's just an opioid crisis. It's not even an addiction crisis. The addiction crisis, we always have like a baseline of people that are drug addicts that are dying from overdoses. It's not a huge number, and it's not the one that's spiking. Now, you could argue that there is a lot more of those people that are falling into that because their opioid prescriptions get too expensive or they get to the point where they don't work anymore and they go up the ladder, and next thing you know, heroin is the option because it's cheaper and it's more readily available than going through doctors and paying for expensive prescriptions. So you're just flat out wrong, Kevin. You're flat out wrong. This is not an addiction crisis. Addiction is a serious issue, but I don't see what you're talking about, how you're handling it by, you know, and in the clip, the lady's going to say how some people use their meds correctly and other people, you know, don't. And it's kind of like she's implying that, you know, we got to be careful how we handle this. We don't want to like go out and just blanketly arrest everybody that uses opioids and has prescriptions or whatever, but we want to find people that abuse them, people that are getting too many scripts, and people that are, shopping around for doctors and all this shit so he can beat them down and make a good enough example out of them. Maybe the others won't be bad. See, this is just the fucking complete wrong way to go about this opioid crisis. And it reminds me fucking chillingly of the crack epidemic in the 80s and how they handled that. Unbelievable. They think they made some victories. Like, they probably think that they won the crack war or whatever. But I'll tell you this, probably more people smoke crack today than did in the 80s. And probably it's out there, they didn't stop crack. It's not the big epidemic that they talk about on the news all the time because they just have better things to talk about, like this, because thousands of people are dying every year. Tens of thousands. I don't think you ever seen those kind of numbers of people dying from crack. In fact, I don't think it's just not even a thing. People don't die from crack like that. Unbelievable, man. So Sabet, of course, as we all know, has a history of anti-marijuana claims. His recent research shows that his claim that legalized marijuana makes the opioid crisis worse is simply, it's wrong on so many levels. You could write a fucking book about it. One of the things that's the most wrong about it, though, is just the simple numbers, the pure data. And this is a good correlation study where you look at, this happened, so maybe this happened because of it. Now, they do that with car accidents and insurance claims. Car accidents and insurance claims went up, don't you know, since Colorado legalized marijuana. That's what their argument is. But they don't connect those fucking accidents at all to the marijuana. Even if they find marijuana in someone's system after they've been in an accident. They don't say, well, this is how much marijuana we found and that they were high at the time of the wreck. So they don't have actual correlation. They're just like paranoid delusion style. Like, hey, that has to mean it's the marijuana legalization, huh? No, it doesn't. I suppose if fucking homicides went down after legalization, we could say that too. Oh, look, more legalizing, less people kill each other. Bingo, let's do it. But, this is a good one. This is the one where you're like, okay, people are actually taking less medications like opioids and benzodiazepines when medical marijuana is readily available. People are drinking less alcohol. People are taking less opioid pills, less opioid deaths. There's less opioid hospital visits for overdoses, all that shit. But Kevin don't want to look at them statistics, and it's fucking sad. But anyway, a 2014 study published in the Journal of American Medical Association concluded, quote, medical cannabis laws are associated with significantly lower state-level opioid mortality rates. In March 2017, NBC News reported on a study which found that in states that allow legal medical marijuana use, hospitalization rates for opioid painkiller dependence and abuse dropped an average of 23% compared to an average of 13% drop. In October of 2017, the Washington Post reported on a study which found that recreational marijuana legalization in Colorado led to a reversal of opioid overdose deaths. According to the study's authors, opioid-related deaths decreased more than 6% in the following 2 years after Colorado legalized recreational marijuana sale and use. So you can correlate them if you want. I don't care if you do or not. It doesn't matter to me. I don't care if you believe that or not. But what I don't like is when Kevin Sabet goes out there and fucking acts like there's no help from marijuana and it's actually making the situation worse. Are you fucking kidding? It's just flat out ignorance, man. You're an ignorant fool. And I don't even think it's really about the money that you line your pockets with for doing this garbage. Wow, this has 521 comments. And, yeah, I'm sure there's trolls in there, but I ain't got time for that right now. I was trying to make a short video, but I definitely still want to watch this.
President Trump vowing to help end the opioid crisis gripping our nation during his State of the Union speech. Watch this.
My administration is committed to fighting the drug epidemic and helping get treatment for those in need, for those who have been so terribly hurt. The struggle will be long and it will be difficult, but as Americans always do, in the end, we will succeed, we will prevail.
But a new congressional report suggests Medicaid fraud might actually be driving the opioid crisis by making it easier for the enrollees to abuse and then resell the highly addictive painkillers. Here to weigh in on this is Dr. Kevin Sabet. He is a former White House drug policy advisor and an affiliated fellow at Yale University and went to Oxford. Very informed, worked for 3 administrations. Thank you so much, Doctor, for being with us.
Thanks for having me, Ainsey.
So what's the real problem here?
Well, there's multiple things going into the opioid epidemic, and there's plenty of blame to show. There are seemingly, with Medicaid expansion, there have been some issues with fraud, but that's also been a way for people to get treatment too, so I wouldn't throw the baby out with the bathwater. There's plenty of blame on all sides on this. Even private insurers are to blame. Many of them won't cover quality addiction treatment. We need quality addiction treatment in this country. We need funding for it, for the president's...
How about we need it so that people don't even get addicted in the first place? And how do you do that? You prescribe them something that's not horribly addictive, like opioids. And what could that be? A safe substance that you can't die from overdosing, that works for chronic pain. Oh, yeah. If someone's going to have pain for like 20 or 30 years, medical marijuana seems like a lot more... Common sense would tell you that it's just, a lot less risky to be on, and it's way less addictive. So come on, man, none of these people care about fucking solving this opioid crisis if they're going to continue to demonize marijuana or cannabis or whatever you want to call the shit. And this guy is definitely the #1 guy out there trying to keep marijuana as far from being available to everybody as possible. Why is that? What does this guy got against us?
Opioid Commission, which was a bipartisan commission, put out a very good report. Now we need to see Congress and the administration fund those recommendations.
And they're, like I said, this guy just wants to get all the money going towards his buddies. He's got buddies in all these sectors. Big pharma that wants to make a anti-addiction vaccine. They got pills for opioid addiction already, like methadone, and you got your Suboxone and other blocker type things. And then you got, quite frankly, they try to wean people off of opioids with other opioids or analogs like tramadol and shit. So that's one avenue. Then he also wants the money going for his little rehab centers, because they're not his, but I mean the people that he's stumping for, that's what they got. Chris Christie basically pioneered that shit in New Jersey, where you make people swear under oath that they're marijuana addicts, and then
that's how we're going to get out of this crisis.
I mean, so many people need painkillers for whatever they're going through, and they're not abusing it, but there are so many that are, and unfortunately something has to be done. And those folks who really need the medication, we don't want them to them to have to experience
it's a balance
pain.
Absolutely. The vast majority of people who are prescribed painkillers actually don't have a problem with them. It's a small minority, but that small minority consumes over 90% of the pills. So there have been a lot of opioid
there's just a lot of problems with that assertion that 90% of all the opioid pills or whatever are getting gobbled up by just a few bad apples. I mean, come on, man.
Manufacturers who have been encouraging overprescribing. In fact, many attorneys general, from Mike DeWine in Ohio to Mr. Schneerman here in New York, they have actually taken suits against the opioid manufacturers because of their false claims. So
I got to give them credit. Like I said before, although I despise this guy, I have no use for him. He's making some good points. The opioid crisis isn't just something that you can pin the tail on one donkey. It's many donkeys, and it's also many elephants in the room, if you will. And it's on both sides of the aisle, the corruption, and the big pharma is pushing this narrative that right through this guy,
There's a lot of blame here. I wouldn't put all the blame on Medicaid. We don't want to throw the baby out with the bathwater. That can be a way to get people to treatment, but
see, again, now he's trying to say that Medicaid, we need Medicaid to stay there so you can make sure that the people that we've gotten addicted to these substances, before they die, we can send them to rehab and give them all these other medicines and maybe save them from addiction.
Issue is we need high quality treatment in this country and we don't have it.
Okay, the numbers are just staggering.
Yeah.
170,000 recipients of Medicaid are doctor shopping.
That's not a staggering number. Did you hear her? The numbers are staggering. No, they're not. Since 2010, that's 7 years. That's not staggering. That's barely one person per state per year. Or wait, 50 times 10, 2 people will give you. But come on. This is ridiculous. Give me a break. This is not staggering. And this is not that big of a deal. And so, like I said, they always punch the smallest person. That's what Republicans do. They find the weakest person and then they punch them. In this case, you have poor people that can't even afford their own insurance are forced to get Medicaid so they can get prescriptions. And then, so you got them. So you say that you got a bunch of abuse going on. Literally, she says it's driving the opioid epidemic. When you say something's driving something, that means basically like if you took care of that problem, the opioid epidemic would probably not go very far. It probably would end. Is that what you're trying to say? None of this makes sense. This is not staggering numbers. All right. You want an individual case by case situation. I'm sure there's millions of people on Medicaid that don't abuse the system. All right. And Republicans always say that people are abusing the system. It's always the poor people. It's always the poorest people in the fucking country. There's not enough of them to abuse the system hard enough for the system to be broken. The system is broken because of the corrupt bullshit and all the money bags floating around up there to keep corporations basically crushing us. So, I don't know. They literally don't care. When Trump and his minions were sitting there at the beginning talking about this shit, he was like, oh, we will get through this like we always do. We will prevail and we will get through this. We will get through this. Trump, how the fuck are you going to get through this? And he's just saying that to to put you back to sleep. Somebody woke you up and was like, hey, people are dying from opioids. He's like, oh, don't worry, go back to sleep. Because they don't care that people are fucking dying. They don't care that people are hopelessly addicted. All they care about is getting rid of them pills that they got stashed in them warehouses.
They're going to 5 or more doctors.
Yeah.
That's
boy.
insane. How do you...
It sounds like Rush Limbaugh. You guys never said too much about that shit when he got caught doing it. He had a fucking suitcase full of Oxycontin one time, and then another time they caught him with a suitcase full of Viagra. You guys never said shit about all that. You don't care. Not unless it's somebody,
prevent that?
Doctor shopping is a huge issue. Well, we need states to get on board with prescription monitoring programs. And again, it's not just Medicaid
like a
recipients.
Database, so
a
that
database, which we've begun, but we need to actually have some teeth behind that database. We need to do much better doctor prescribing.
Teeth behind the database. That means people getting arrested if they do something that they don't like. This is unfolding just like the crack epidemic in the 80s. Only difference is there wasn't a bunch of 60,000 people dropping dead a year from crack. That never happened. And they act like they won the war on crack, but there's probably more crack there, in the streets today than there ever was. It's more widely available. The DEA never has any victories. All they do is get rewarded $1 billion extra every year just for doing nothing. The drugs keep going without missing a beat.
We need to, in some states, we need to limit prescribing for those who, have a history of it.
Now, what happens here, and part of this whole opioid thing that no one talks about again, is the Afghanistan situation and the heroin situation. The heroin is everywhere. It's not just like in the heroin places where, the bad part of town or whatever. Now you can get heroin in any town, in any place in the USA. The smallest town you can find, I guarantee you someone can sell you heroin there. And you know what? There's no way that happens just because of a bunch of drug runners and mules. That is an institutionalized system that installs that heroin in those fucking communities somehow. And it's coming from Afghanistan. How stupid do you think we are? We consume 80% of the world's heroin. and we're only 5% of the world's population, yet somehow, you know, the DEA is acting like they're doing something about it. They're not doing shit about it. And what he's talking about, cracking down on doctors and patients and shit like that and figuring out who actually needs the opioids and who don't, you're going to throw a lot of people under the fucking bus, and they're going to go to the streets, and when they go to the streets, they're going to find heroin. This has been played out a million times, and it just keeps on going. Nothing these guys are talking about or doing, from Kevin to this lady here to all the way up to Trump and Chris Christie, and none of those people none of them care about anything but what their donors want. They don't care about people dying. They don't care about people getting addicted to opioids. They don't care about people, you know, churning tricks in the alley to support their habits. They don't care about none of that shit. But they want you to know that if you get caught with too much marijuana, that you're going to go to prison and get sexually assaulted there. That's really what the underlying knowledge of, you know, your crime is. So
addiction, you know, doctors should be asking when you go to the doctor, you know, they should be looking at your history, and that's how we see addiction as a health issue. We need to mainstream it into regular health care so that it's not just in the church.
There he goes again.
Basements only, because of
church basements. All right, so he's talking about we need to streamline this into the main health care. In other words, we need to figure out ways to make Medicare and Medicaid pay for it, and health insurance companies. As long as it's not marijuana, right?
If we continue to do that, and we continue to do things like legalize marijuana.
That's your one solution that you could use to help people get out of heroin or to get out of opioids or to never get in them in the first place. But, you know, you got all the answers, man. You're the smart one. Now, remember, guys, if you look at the map where all the heroin and the opioid deaths are concentrated, what are the things that you see? The two things that stand out the most about those areas. Number one, the Republican-ran, right-wing, ultra-conservative, Christian, Bible Belt, whatever, all that shit. You know, like the southern part of Ohio, Kentucky, Tennessee, Alabama, West Virginia. And, wow, what else about those places? Missouri, What else is there about that? Oh, yeah. The marijuana laws there are really strict. And there's really no marijuana to be found. You really have to go to the black market. And when you go to the black market, they also have pills and heroin and meth and methadone and all that other stuff. And they don't care about your ID either. They don't check IDs. So, okay, legalizing marijuana. Bad. Okay, we got you. We heard you.
And these other very harmful policies.
I don't understand what he's talking about. If we continue to legalize marijuana and these other harmful policies, please expound on that. He don't. But I would like to hear what you were talking about there, because it seems like the policies are all going the wrong way. The healthcare is getting shittier, so now we're going to have less help for drug addicts. We're going to have less help for programs that fucking are directly assisting people to get off of drugs. Everything that you're talking about is bullshit. So, I don't know. Maybe he's trying out for a job there at Fox and Friends.
We're going to make the opioid crisis much worse.
That's true. I like that soundbite. I love that soundbite. We should just cut that one out of there and just like play that everywhere. That's what we're trying to do. We're trying to make the opioid crisis worse by ignoring marijuana and by basically cracking down on doctors and patients and then offering people more medicine to get out of their fucking addiction to medicine.
This is an addiction crisis.
You hear that, California?
And many other states. This is...
This lady acts like she's my mom or something. Did you hear that, California? Bad, bad, bad. We don't want you smoking marijuana. It's bad. It's going to make the opioid crisis worse. He's fucking so stupid, man. You know, you guys are so... What about California? You know, California, they're going to prove that you guys are idiots. And already, like I said just a minute ago, when you look at all the states where the opioid epidemic is the worst, it's not California, because they've had good access to medical marijuana since the 90s. It's not Oregon. It's not Colorado or Washington, these places haven't seen those ridiculous spikes. I mean, sure, they have seen a lot of deaths, and a lot of it is that same refrain, the overprescribing and people taking opioids and they're mixing them with benzos and all these other things that might react with fentanyl a little bit different, because fentanyl, let's face it, is way too strong to be prescribing people, in my opinion. And I mean, I just did a story on the weekly show about Texas where they have this rule in their CBD program where a nurse has to come and administer the CBD to you. Why don't they do that for fucking fentanyl? CBD cannot possibly, you could eat a whole truckload of it and not die. But fentanyl, you get some in your fingernails and you can die from it. So, I don't know, man. I think these people are all goofy. This is all a big show. It's all theater. They know what to say because they know what not to say. So they can say everything but the thing that they know not to say, which is cannabis can help us out of this opioid crisis.
An addiction crisis, not just an opioid crisis.
Now, that's another thing that he keeps saying that's bullshit. It's not an addiction crisis, Kevin. It's a fucking opioid crisis. These people that are dropping dead, not all of them are addicted to opioids. All right? Some of them just have a prescription for them, and they have heart medicine, and they have, medicine for their this and that, their GI medicine and their diabetes medicine. I mean, by the time a lot of these people that are dying are past 50 years old, they're on 4 or 5 meds. Well, when you throw fentanyl in the mix to people that are used to taking like Vicodins or something, and they're mixing it with all these other drugs, and the doctor's not really telling them that much about the interaction, well, you know what? That's a lot of the people that are dropping. They're not addicts, all right? And overall, if you are talking about the addict population, the population of people that are hardcore drug addicts, yes, that number is increasing, and those people are dying too. But the number there stays a little bit more steady than numbers of fentanyl or the spikes in heroin. And it's like I said about Afghanistan, man. The heroin and the fentanyl number is going to compete with each other, while the number of regular opioid deaths from like pills or whatever, that stays basically the same. And so it also stays the same that just the regular everyday run-of-the-mill hardcore drug addicts. A lot of them live to be 90. But when it comes down to is that they're dying too because fentanyl is showing up in their heroin and they die from it. A lot of famous people have died from fentanyl in the last 5 years. So I don't know. I mean, I don't really know what you're trying to say, Kevin. It's not as much of an addiction problem as you're making it out to be. And the way he's saying it, he's framing it like this is an addiction problem because America just has an addiction to getting high and to doing drugs. All right. So if that's the case, why don't you admit that? And then we can go handle it properly and handle it like it's a public health situation, which it is. 65,000 people died in 2016. That would pretty much, that's a fucking public health emergency. Not marijuana. You're acting like, oh, yeah, we have an addiction problem in this country. It's not just the opioids. Yeah, it is. Marijuana's not killing fuck all anybody. It's not. And marijuana interaction doesn't kill anybody. None of it. THC, CBD, none of that shit.
Since these are people who are using opioids, mixing them with alcohol, benzodiazepines, multiple things going on. We need quality mental health care. This is a comprehensive response. We got to fund the Opioid Commission's recommendations.
Yeah, he just summarized all the ways that we need to give money to his friends, the people that pay him to talk.
Good deal. Thank you so much for being with us.
Ainsley.
You did a great job shilling for all your buddies, and yeah, that's what's going on, man. That is what's going on, guys. Kevin Sabet still out there doing this shit. I mean, this picture right here lives on in infamy. This guy is a dangerous propagandist. And that's all there is to it. The guy, he doesn't have anything that when you have opinions like his, they're bought and paid for. When you open your mouth, all I hear is the cash register, ching 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 ding. That's all I hear. I hear the cash register, like on that song Money by Pink Floyd. This guy doesn't fucking make any noises out of his mouth except for that. And he's speaking for Big Pharma. Make no mistake about it. He's speaking for corrupt entities within the government that want to install rehab facilities in your neighborhood. Piss test you no matter what. If you burn your piss test for marijuana, they want to put you in this fucking facility that's kind of a cross between a mental institution and a jail, it sounds like. And they want you to fucking get better because smoking marijuana is bad and wrong. Just like that condescending host on that Fox and Friends was like, do you hear that, California? I mean, what the fuck even is that? Are you my fucking mom, lady? I don't fucking know you. You don't have the right to look down on people because they do something that you don't approve of, that's not hurting anybody else. Anyway, so, you know, go ahead and check to see if you're subscribed. And if you're not, hit that subscribe button because, you know, I'm probably going to keep on doing these videos as long as people keep on showing interest in it. And I know who my diehard fans are or whatever, people that listen to this shit. Thank you. I can't say enough how far I've come from just being interested in sharing my opinions about these stories with everybody. But now that we're well on our way to seeing prohibition end, we all go there together on this journey. Thank you and have a good one.